Community oncology is facing a significant number of challenges these days. There's significant pressure from the government. They want to slow spending, and cancer is typically right there at the top of the list because there's so many new drugs coming out in the market. There's also pressure from the provider standpoint that a lot of reimbursement is being reduced from the payers. At the same time, you have increasing cost of drugs. You have to pay employees more. It's more difficult to find employees. There's nursing shortages, there's physician shortages that are coming into play. Real estate has become more expensive. So our organization, we've been able to overcome any roadblock that's been put in our way, and we're far from perfect, but we've been able to manage effectively in the changing environment. We're moving from a traditional fee-for-service, where the more you did, the more you got paid, to now being held accountable for reaching certain quality standards or outcomes and managing the total cost of care. Healthcare has become a bigger and bigger part of our economy, and especially with an aging population, with a lot of the baby boomers continuing to live longer, which is tremendous, but it puts a lot of strain on our healthcare system in general. And every few years, there's something radical that, whether it was sequestration at one point, we've had the payers consistently putting pressure on community-based oncologists. But we've been able to bring more services to the table for our patients. We've expanded our laboratory services, our pathology, our specialty pharmacy is world-class, as well as our pathology in our lab. We've continued to expand our clinical research capability. We have over 100 active trials as we speak. We've been able to successfully manage in a changing environment with shared savings contracts that have been put out there from the big commercial insurance carriers with Blue Cross Blue Shield, Cigna, United, as well as the government with the Oncology Care model. And I think that's why we continue to invest in sites where patients live. It's going to be harder for patients to travel. With these 60% of our patient base is Medicare, Medicaid. These are people on fixed incomes. They can't travel long distances. So we're going to continue to do what it takes to attract top talent, both at the physician level, nursing, and as well as all of our support staff.